Okay, hello everyone. Thanks for attending today. This is our weekly news briefing from the Champaign County Emergency Operations Center. I won't spend too much time talking myself today. I'll get right to the speakers. As we always do, we're going to start with Champaign-Urbana Public Health Administrator Julie Pride for some local updates. Julie?
Hi, good afternoon. Champaign-Urbana Public Health District is reporting a cumulative total of 135 cases. That includes 10 that we reported yesterday and 11 that we're reporting today. It's important to understand that testing is really increasing a great deal in our community, so we do expect to see more positives. Currently, there have been 3,128 tests completed. A total of 40 cases are still in isolation. That means they're active cases. We currently have 6 who are hospitalized, 89 who are considered recovered, and a total of still 6 deaths. We are, like I said, testing is really increasing. So anyone in the community right now who has any COVID symptoms, and that includes fever or cough or shortness of breath or unexplained fatigue or loss of taste or smell, they can call their healthcare provider to get into a test site. There are quite a few test sites in the community now. And if they do not have a healthcare provider, they can call Champaign-Urbana Public Health District's COVID hotline at 239-7877. Additionally, and this is new as of last week, anyone with or without symptoms who work in any healthcare facility, including nursing homes, long-term care facilities, group homes, those who work in correctional facilities, such as jails or prison, who serve as first responders, such as paramedics, EMTs, police officers, firefighters, or anyone who works in critical infrastructure jobs. These include child care, workers in grocery stores, pharmacies, restaurants, gas stations, public works, factories, and sanitation. And I also wanted to really thank the community. Yesterday at the mask drive, there were almost 4,000 masks donated that individuals in our community made and donated to frontline workers. So thank you very much for that.
Okay, thank you, Julie. Next, we'll go to Cindy Maximun. She is a registered nurse, and she's the site lead for the Pandemic Health Worker Program at OSF. So Cindy, go ahead.
All right. Hello. Great to join everybody this afternoon. So OSF, when COVID-19 started to appearing in Illinois and maybe even a little bit prior to that, we launched a multi-pronged digital approach that include integration of an AI, artificial intelligent symptom checker into our digital assistant, Claire, our chat bot. You can find her on our website, osfhealthcare.org. She shows up in the bottom right-hand corner. She's very intuitive, and you can ask her several questions, and she'll kind of direct you accordingly. We also offered a free text messaging service, COVID Companion, which offers guidance and education on the virus, along with a 100+ person 24/7 nurse triage hotline. And that number is 833-673-5669. And these nurses field questions about the virus 24/7, 7 days a week. We also offer video visits with physicians and advanced practice providers. With the overwhelming response to this digital approach, we were able to expand services and launch the Pandemic Health Worker Program a few short weeks ago across the ministry. So what this is we are able to digitally monitor people in their home. These are folks that may be called our nurse hotline. They have concerns. They may have symptoms of the coronavirus, and they've been instructed to isolate at home. So we are going to be with them along the way. We have healthcare or health workers that once they enroll into the program voluntarily, we drop off care kits. There's no direct contact with the clients. We drop them off on their doorstep. We do call in advance so they know that we are coming. We return to our car, and once they get their kit, if in fact they need a smart device, if they don't have one, because there are applications that they will need to connect with us digitally on a daily basis, we provide a tablet for them. The tablets we provide will all be preloaded with the applications that they need, such as Get Well Loop. That's a digital platform that they correspond with their callers day to day, checking in with us. We also, part of the kit is a guide, so they prepare for their next 14 days. And if they're downloading the apps themselves, there's guidance on how to do that in the booklet. And it kind of explains all the applications. There's Google Duo. Some clients may be, wanting to connect with us via video, face-to-face. They can connect with advanced practitioners and providers if they need to. Along with that, the other applications we do have preloaded would be the Silver Cloud. You can learn more information about Silver Cloud at osfhealthcare.org/Silver Cloud, all one word. And it's an app, and it's kind of under our behavioral health umbrella. It offers very interactive modules on stress, depression, and anxiety. There is an opportunity to connect with a behavioral health navigator if the client chooses to. Otherwise, they can go through the modules on their own. If we find that the client's symptoms are worsening, within the Get Well loop, it sends a yellow or a red alert, and a nurse follows up with that client, so they may have more of an interaction with a provider, whether it be an advanced practice nurse or a physician. Alongside the pandemic health worker program is a program we call acute COVID-19 at home. So if a client needs more monitoring, such as blood pressure, oxygen saturation, we provide another kit with all of these tools for them to use. They don't per se use the tablet that we first dropped off. There's another tablet within this kit. It's an actual iPad. So it's a higher level of monitoring. And if that client needs hospitalization or to even seek a higher level of care, then we facilitate that as well.
Okay, thank you, Cindy. So with us going into a new month of extending the stay-at-home order throughout the state of Illinois, we wanted to highlight some mental health topics. And we have a local expert here today. Dr. Tara Powell is an assistant professor at the University of Illinois School of Social Work, and she's going to talk a little bit about stress and mental health going into the next month.
Oh, great. Thank you, Chris, or thank you, Patrick. So one thing I just want to say is it's so wonderful that you all have some of these resources for people with who are experiencing mental health issues, particularly around stress and anxiety. Especially because we are having this prolonged stay-at-home order. A lot of issues of anxiety are coming up. Being separated from family members is something that I'm seeing time and time again, especially younger people being separated from older family members, experiencing death in the family, not being able to go to funerals. That's an issue that's coming up quite a bit. Then there's also a lot of people who have that ongoing prolonged anxiety and fear around the virus. And so just being scared to go outside, not knowing what's safe and what's not safe. Having all sorts of different types of information given to them and getting one message one day and another message another day really can cause heightened anxiety in people. And then, just that stress of being socially away from people, as we're very we're very much social creatures. Not having a person that somebody can talk to, and having a person feel really isolated, just can trigger, if somebody had mental health symptoms before, can trigger those mental health symptoms or exacerbate them. Or say somebody has never experienced a mental health issue, you know, new symptoms can arise. And the longer this goes on, the mental health issues will continue. And, you know, as long as people have the supports, which I know there's a lot of community supports out there, that's really great, but we also really need to make people be aware of common mental health symptoms and feel normal and not feel that they're experiencing abnormal reactions to, or that have let them know that they're experiencing normal reactions to a very abnormal situation and that there's supports out there for them.
All right, thank you very much. Yeah, obviously so important to be aware and acknowledge and understand those. So this is the point where we're going to go to those who have joined us to see if anyone has questions. So like I've done previously, I'll go down the list and just see if people have a question. If you don't have a question, that's fine. You just let us know that you don't have a question. We'll move on. And also, if you could try your best to address your question to a specific person, that makes it go a little bit more smoothly. So Christine, you are first on my list.
Yeah, hi, Julie. Just regarding the 2 nursing home cases this week in Champaign County at Clark Lindsay and at University Rehab, I just wanted to hear your comments on that, how that situation's being handled, and whether these cases suggest protocols aren't being followed or need to be enhanced or changed.
So far, I mean, they've done an amazing job. There's still only 1 case at each place. We're still trying to determine how that happened. But with people who are in long-term care facilities, you know, sometimes, you know, it's a skilled nursing type facility. So sometimes they have to leave there, sometimes by ambulance, and go to hospitals. So that is one way that they could be impacted or infected, although we have not found that. But there's just different situations. It makes it tricky to try to find out, you know, trace it back. But so far, those are still the only cases. They've done, you know, I know Clark Lindsay, we've been working with them. We have a support team that goes out and meets with all the different long-term care facilities and helps them, you know, just review their protocol and just kind of be there to support them. And we're providing personal protective equipment through the Strategic National Stockpile. So, and we're doing, you know, everybody there will get tested. And at some point, we're going to have all of the long-term care facilities tested in our community.
When you say everyone there is being tested, is that both residents and staff? And is that both Clark Lindsay and University Rehab?
Yes, that is the protocol. If you get a case, is to get everyone tested and then make sure that, you know, you can get it stopped. So far, so good.
And when you say you eventually want to be able to test everyone, I mean, you mentioned that the criteria loosened to include healthcare workers at facilities, including these long-term care facilities. How frequently can people get tested who work there? Is that like weekly, or is that, because that's like regardless of symptoms? So I'm curious to know how you're implementing that.
Well, to start with, you know, everyone that needs to or wants to go get tested that works at a facility like that can go. They can call us and we can get them in through the drive-through. Right now, there has not been anything established. You know, ideally they're being in isolation when they leave there as well. So, or not isolation, but, you know, we're under the stay home order. So that limits the opportunities to get infected somewhere else. And I know that all long-term care facilities in the county are really working with employees to make sure that they are, you know, masking up and being super careful when they're out and around anyone.
And for residents who are, when like testing is opened up to healthcare workers, that doesn't also apply to residents at those facilities, right? It's just the staff?
No, it will be for everyone. Yeah.
Oh,
That's in the process. The state is rolling that out right now. they're going to, it's something that they're getting ready to roll out statewide. We will, we're already starting that here locally. So we're putting together the information and the protocols and everything, and then we'll start moving forward with that.
Okay. And then I think last week you mentioned an outbreak is considered when there are 2 confirmed cases. So is that why the public wasn't notified by the public health district about these 2 cases?
No, I think that, I don't know that we would have notified the public anyway. In Illinois, what happens is if there is any case at a long-term care facility, be it in a resident or an employee, they have to notify all of the family members and everyone, associated, everyone living in the entire campus, if it's a large facility. So they need to do that, and then they will let us know. That, typically public health only alerts the public if they're in a situation where there is like a need to know type of thing. So again, I always go back to measles, and we did that because people were at increased risk for being in a place where somebody might have, had breathed out measles during a two-hour period after they left. So with these, it's all about notifying the people and contact tracing. And right now it's mandated that that gets done by the nursing home or the long-term care facility itself. So there's no role for us to do it.
Got it, thanks. I have more questions, but I'll let others chime in if you can circle back if there's time.
Okay, thank you. Cole, I've got you next.
All right. Christine actually asked a lot of the questions I was going to be asking about, but as far as the, you mentioned that the state is rolling out this plan to, or this is for Julie, by the way, but you mentioned the state is rolling out these plans to get all these tests to the community, and Champaign's already working on implementing that. As far as getting the residents at these facilities tested, I mean, is that, whose responsibility is it? Would the test be brought to them, or would they need to be transported to one of these drive-through testing facilities?
No. So the employees can go through the drive-through facilities whenever they have symptoms or now. And the residents, there will be support teams that can come into the facility to help do that if the long-term care facility doesn't have trained staff to do that already. So a lot of the places are going to do it on their own because they already have experience doing those swabs. We'll get the materials to them, and then they can get the test, and then we take them to the lab, and then we get the results back hopefully within 24 hours.
And being able to test at facilities that haven't had any reported cases yet, how much will that help them be preemptive in some of their planning as far as quarantine space? Because a lot of these places, I mean, they don't have a wide open wing for them to just kind of put people in when they're planning ahead for when that, if they do get that case, that initial case.
Yeah, well, first of all, we don't want to have enough cases that we need an entire wing. I can tell you that. So, what it will allow them to do, and again, the infection control protocol they have in place is really solid. So if they were to get a case, and the case is transferred to the hospital and then transferred back, they will be isolated in a room for that, until they're recovered.
And you mentioned that Champaign County is already implementing some of these plans. I mean, is the county there? Are they able to do this to the fullest extent that they're expected to, or are there still steps to be taken?
The long-term care facilities in Champaign?
Yeah, being able to test all of these. Are we at that capacity yet?
Yes. Well, no, not to just go in today and get every single one, but the test kits are coming. So we order them, and then they will do that. As far as getting all the employees tested, that's no problem at all. It's just getting the stuff into the facilities to do that, because what we need to do is get our support teams, talk to each place and assess their capacity to do this, and then see if we need to have someone go in there as a support team to assist with that.
Great. Thank you. That's all I got.
All right, thank you, Cole. Haiti, you're next on my list.
Thank you. So my questions are for Julie. I know you mentioned that there were about 4,000 made masks that were collected through the drive. And I know tomorrow with this new executive order that'll be extended, the face mask and the coverings will be required for people 2 years or older and who can tolerate the mask. Can you just kind of talk about the enforcement, what that will look like, and if someone is walking around in the park and they're not wearing a mask, what could happen?
Well, in Champaign County, we like to do education and get voluntary compliance. And for the last, 2 weeks, we've already, if you go out in Champaign, you see a lot of people wearing masks. I think that a lot of people understand that the goal of that is to prevent essential workers from getting infected as well. So, I think that we're going to have really high compliance with that because people do seem to understand it. I don't know, if you're in the park, that's one thing. Again, it has to do with you being around people and not being able to maintain 6-foot distance. So it's super important when you go into a facility. You go in to pick up food, you go through a drive-through, you go to a pharmacy or a grocery store, or you have to pick up some essential item, go into a healthcare facility, come into public health, even some jobs. They're not able to maintain 6 feet. They need to have those masks on in all those types of situations, or a face covering. It doesn't have to be a mask.
So if someone isn't wearing one, can a business, refuse to offer them service?
A business can always refuse that. I use the example of the no shirt, no shoes, no service. We used to have those signs all over the place. So yes, businesses can put something up like that and just say, if you do not have a mask covering for the safety of our employees, get up, cover your face. It does, again, I have to keep stressing, it does not have to be a mask. So, if you don't have one of the handmade masks or a purchased mask or a home sewn mask, it's okay to use a scarf or a bandana or anything like that, any type of piece of cloth tied around there, just to get yourself into a store. So I would encourage people to keep them in their car or in purse or whatever, should they need to go into a facility.
And is this requirement something that you think should be extended beyond May to further prevent the spread of COVID-19?
Yes, I think it will be something that will be going on for a long time until we get this pandemic, over with. And again, I like to remind everyone that this pandemic will end. It absolutely will end. It does not seem like it, but it will. And that's an important thing because we do not want people who may be asymptomatic out there spreading it. And when you talk and when you cough or sneeze or anything, even when you talk, there are little droplets flying out of your mouth that you can't see. So it's a good idea to have those on just to lower any potential virus out there in the environment.
Thank you, Julie.
You're welcome.
Okay, that's the end of my list. I think we have a couple more minutes for Christine if you have
Oh, yeah. So Julie, just a couple more about the nursing facilities. I mean, you were saying we don't know how COVID-19 got into these facilities. And you've talked about before about protocols that you've offered, that you guys offered to them about infection control and that those are being followed. But how are those protocols enforced? How do you know whether places are complying with the guidance and the training that you've offered?
Well, we have support teams who will be going in there and who are going in there and just checking with them. We also do calls to discuss things, and it's really a supportive type of we're not regulators. We're not going to go in there and start hammering on them about this. That's Illinois Department of Public Health's job. No, I'm kidding. But we're not the regulators. What we're doing is we're community partners who are going in there to really offer support. We have the PPE for them, the personal protective equipment. We have expertise. We can bring Illinois Department of Public Health. They have some specialists in infection control. So a lot of times it's just talking through different situations and being here if they have questions, and they can all contact us at any time, and just providing that support. But it is trust and verify, though. I mean, we do go in there.
Yeah, and I don't know if this is outside the purview of your local health district, but I did look up University Rehab Center. They were cited for a couple deficiencies in a report from November 2019, and one of the deficiencies was about improper use of personal protective equipment when delivering care to a resident, contact isolation precautions. Are these the type of things that your agency follows up with? Are you saying that's outside of your purview for following up on citations to nursing homes when they show up in these inspection reports?
Yeah, that's the state's job. So we are in long-term. So Illinois Department of Public Health regulates long-term care facilities. Now, we're in there already for food service and that type of thing. But during COVID-19, we go in there. We also, way early on, we've met with them. And in Champaign County, we have an infection control group that meets, I think, 3 or 4 times a year to kind of brainstorm ideas and talk about potential problems and work through them before anything does become a problem. But no, we do not go over to a long-term care facility and regulate them. That is Illinois Department of Public Health.
And then my last question is just what's your message for families with loved ones who are in nursing homes or senior centers, as we keep hearing about COVID-19 cases cropping up in different places?
I mean, I understand the anxiety related to that. It is very scary. Every time you turn on the news, it seems like there's another one. All I can tell you from Champaign County's perspective is they are doing a really good job. It is such a contagious disease that once it can get into a place, it can spread really rapidly if there are not good infection control procedures in place. They have been at the long-term care facilities, they've all been masked up for a long time, which is, again, the same concept of what we're asking the public to do. So in case you're asymptomatic, you have no idea you have it, that you can't spread it that way. Extensive hand washing, cleaning of surfaces, social distancing. So they have been doing stuff way differently for quite a while. But again, with skilled nursing care, there's a lot closer contact. So, and there is the need for them to sometimes leave and go to a healthcare facility, a hospital, or something else. So, it's just a matter of keeping on top of that and keeping on top of staff and monitoring for symptoms and urging them to not get around other people when they're off work, off duty.
Is it accurate to say that that facilities can be doing everything according to a proper protocol, but cases can still creep in even when best practices are being followed?
It is definitely possible. Hopefully, with the infection control practices in place, if a resident were to become infected, hopefully that could, with those infection control, it would keep it from spreading. And that is certainly the hope and the
just
planning.
one more quick thing. How soon will all the residents and staff at these 2 facilities be tested? Do you know?
I know that the Clark Lindsay, which had the first case, they're almost done, and the other one is just in the process right now.
Thank you so much.
Okay, thank you, everyone. I think that does it for today. A couple last resources that we always highlight. 211 is a service provided by the United Way of Champaign County. For anyone needing assistance, they can call 211 and get hooked up with the trained specialist who can find them that help. And then champaigncountycovid19.org is a website that we've been updating with updates on the local response. We now have mask resources up there. So with the order going into effect tomorrow, we're trying to help people out with some information, answers to FAQs, how to make a mask, those sorts of things. So that's up on the champaigncountycovid19.org website right now. And then just lastly, if you have any interest in pursuing stories on any of these topics we discussed today, so the OSF Pandemic Health Worker Program or the mental health topics that were discussed, just get in touch with me or get in touch with Amy Roberts at CUPHD, and we can get you connected with local experts. So that's it. Thank you all very much for attending.